Hello and welcome to Future Talent and Future Heroes. This is our Joined Up Care Derbyshire virtual work experience. So welcome to everybody that's joined. I'm Susan Spray. I'm the programme lead for careers at Joined Up Care Derbyshire. By way of an introduction into the session today, I've got just a few slides to get through before we introduce you to our panel. And the session we expect to last around 35 minutes, and it is being recorded. We hope that you find the session hearing from our professionals from across the health and social care sector informative, whether you're a student considering your options or you're a student already studying health and social care, or perhaps you're already employed or looking for a career change. This is the opportunity for you to find out more about careers within Joined Up Care Derbyshire and the opportunities that we have. The entire virtual work experience programme is going to provide you with a host of different opportunities in terms of how to look for employment with us or apprenticeship opportunities and the sort of entry requirements that we will be looking for in each of those roles. It will also help you in terms of your next steps in progressing your application. The virtual work experience programme is going to include a host of different opportunities around employability, helping you support with completing application skills and conducting interviews. Can you move on to the next slide, please, Bryony? So who's Joined Up Care Derbyshire? Joined Up Care Derbyshire is made up of several organisations within the Derby and Derbyshire health and social care system. You might already recognise some of the names of the organisations that are up on the screen at the moment. Perhaps you've already got friends or family that work in any one of these organisations. Joined Up Care Derbyshire represents all of the health and social care organisations, including the NHS providers and the two local authorities, as well as the voluntary sector and the independent sector and primary care. Next slide, please. So you've already made your first move, your step to considering a career within health and social care. You will be joining a team that is the largest employer in the country. We employ over 3 million people within health and social care, and we are the largest sector here within Derby and Derbyshire. With that, we have over 350 different roles across a variety of different elements of the sector. So whether that be that you're working directly with patients in a clinical environment or working within people's homes, we have a variety of different roles that offer flexibility, career progression, and competitive terms. Next slide, please, Bryony. I wanted to show this slide as a way of introducing to you the different entry opportunities that we have and the opportunities for you to progress and to develop into different roles. So here are just a very light touch example of some of the different roles where you can join the sector with either little or no experience, and then you can progress through a variety of different apprenticeship programs to a more senior role. The virtual work experience programme and each of the modules that you will be embarking upon will show you the variety of different professional roles within the sector. And this is just to give you a sense of a few of those and how you can progress. And as you work through each of the modules, you'll get to learn from more about those and the entry requirements. And today we have got 4 passionate professionals that are going to be talking to you about their chosen profession and role. So before we meet the panel, Brian, if you can just switch to the next slide, please. We'd encourage you to look at our webpage. I showed you before the variety of different organisations that sit within Joined Up Care Derbyshire. Each of those organisations will have their own apprenticeship opportunities and vacancies. We've made life a little bit easier for you by putting all of those opportunities into one central page. So if you visit the joinedupcareers.co.uk webpage or follow us on any of our social media accounts, you'll start to get a feel for the different opportunities and vacancies that are going to be arising at the time when you are looking for your first career move. So without further ado, if we can now move towards meeting our panel. That's what you've all come here for today, to meet our panel and to hear their experiences of working within the sector. So I'm going to now ask each of the panel members, please, in turn. So first of all, I'll go to Abby. If you can introduce yourself and tell us what you do, please, Abby.
Of course. Hi, everyone. I'm Abby. My role is System PMO, so that's Project Management Office, Transformation and Improvement Partner. So what that means is there's a really big programme of improvement work happening across health and social care. And my role is really supporting the teams that deliver that work. So mainly it's kind of improvement projects that look to improve the way care is delivered, or it might be improving, say, staff experience. And so my kind of role is to support those teams, so mainly with kind of reporting. So reporting on how their programme is delivering, what impacts that's having. So hopefully that gives you a little bit of a flavour, but my role is very much non-clinical, so I don't deliver any patient care. I don't really have any direct contact with patients either. I work predominantly from home, although I am based at Royal Derby Hospital. I maybe go into the office maybe once a month, but that works perfect for me because I live in Sheffield anyway, so it's quite a long commute. So yeah, that's a bit about me. Happy to answer any questions, of course. Thank you.
Thank you, Abby. Eleanor, we'll come to you next. If you can introduce yourself and your role, please.
Hello, thank you. So my name's Eleanor Morris. I'm a speech and language therapist, and I work with adults with dementia. So dementia is a condition that affects people's memory, it affects the way their brain works, and sometimes that can impact people being able to remember how to speak or remember kind of what words mean, or affects their ability to understand what other people say. So my job is to support people through their dementia with the communication side of things. And I also help manage any problems with eating, drinking and swallowing. So in speech therapy, we deal with any kind of anything going on in the head and neck and throat area. So that includes any problems with eating and drinking as well.
Thank you. And over to you, Jasdeep. Same question, please.
Hi, yeah, I'm Jasdeep Kaur. I'm an advanced mental health pharmacist. So I work in a mental health trust. There's a few varieties to my role. So one, I am an independent prescriber, which means I see patients with diagnoses like schizophrenia, bipolar disorder, and I'm able to review them by myself as a doctor would, and prescribe any medication and manage them long term. But I'm also the education and training lead as well for our trust. So that means anything related to medication, pharmacy, teaching students, supporting students that come on placements, all of that falls under my hat as well. So yeah, a bit of both sides, a clinical patient-facing role, as well as supporting education and training of students and other healthcare professionals like doctors and nurses as well.
Thank you. Lindsay.
Hi, yes, I'm Lindsay Sparks, and I'm the practice educator for radiotherapy apprenticeships at the Royal Derby. So I kind of, a bit like Jasdeep, have two hats. So I'm work clinically as a therapeutic radiographer, which is where we treat cancer patients predominantly using x-rays in the hope that we're going to cure them or help to palliate their symptoms and ease any symptoms that they have. So I do work clinically 1 day a week, and then the rest of my week is like Jasdeep, supporting students and apprentices. I'm actually apprentice lead, so I've been responsible for the curriculum clinically for the apprentices while they're with us, and I also assess, train staff and coordinate rotas, that kind of thing as well. So lots of hats.
Wonderful, thank you so much. So you'll see, participants, that we've got a diverse group of panelists this evening, and they are representing roles that are working directly with patients, and then the roles that that support those functions. So thank you for that. We do invite the participants to use the chat facility throughout the discussion today. So if you have got any questions, then please do feel free to pop them into the chat. You can ask a general question. If you want to ask one that is specific to any one of our panelists, then please make sure that you include that person's name within that question. Thank you. So next question, please. Eleanor, I'm going to come to you. Can you tell us how you got into your role?
Yeah, so I did the degree of speech and language therapy at uni straight out of going to college. I really found that, so I did health and social care at school and I really enjoyed it, and I really found that I liked English, and I liked science. So I thought, what is the science of English? And that's sort of what sparked my interest in speech and language therapy. The role that I'm in at the minute, so I'm the dementia lead speech therapist in the trust that I work for, and I think it just came from a passion particularly about dementia, and thinking that I would like to really support people with this specific. So it came from experience, and I guess building that experience over quite a while. But I've always been passionate about having a chat with people and having a conversation, and how important conversations are. So that's really kind of what sparked my interest in becoming a speech and language therapist in the first place.
Thank you. Jasdi, same question to you. How did you get into the role?
So I did my what's it called, master's degree in pharmacy, and whilst doing that I realized I had a particular interest in mental health. So immediately following qualification, more or less as a pharmacist, went into a mental health trust, and from there I did my postgraduate certificate and diploma, followed by my prescribing, to then be able to work as a specialist with prescribing capabilities. But much like Eleanor, I think you kind of realize at a school phase, or even maybe a bit later in your degree, as I did, as to what kind of areas appeal to you a bit more, and kind of the biology behind mental health disorders, you know, how they manifest, how they can be treated. That really appealed to me. So that's how I ended up following that kind of route to specialize as a mental health pharmacist.
Thank you. Abby, was your role hard to get into? Was it particularly competitive?
It kind of was. So I think my experience has kind of played a big part in getting into my role. I think, being really honest, I didn't know this role that I'm in right now kind of existed. It's not a role that I knew about at school. It's not, my kind of career is just a prime example of just not knowing what I wanted to do kind of from school onwards, really. But I think, you know, having started in a like entry-level admin job with the county council, and then kind of working my way up, gathering lots of experience, then being able to apply for different roles, kind of working my way up into more senior positions, has been great. So I guess in the sense, there are lots of kind of similar roles in health and social care, I think, around project management, which is kind of similar to my role. And I think they'll probably be quite competitive, because project management skills can be quite generic. So you might be competing with people with similar skill sets that have worked in different sectors. So there's more kind of people you're competing against in that sense. But I think having niche experience and working in health and social care kind of supported getting into this role. So I think how I stepped into this role, I was working in a previous role in an NHS organisation, and I was asked to support the director of transformation for just 2 days a week, because they needed some capacity in the team. So I just did that kind of 2 days a week, just kind of supporting them. And then as that person's portfolio grew, they needed a specific role that was someone supporting them full time. So having done that 2 days a week, supporting them anyway, I was in a really, really good position then to apply for the role and was successful. So I think just being very open-minded and just very kind of willing to embrace any opportunities that kind of come your way really played in my favour then and kind of helped me get that job.
I think you raised a really good point that actually you didn't even know that that particular role existed, and,
No.
and you know that comes back to my earlier point that 350 different roles. So what we're hoping to get out of the virtual work experience program is to bring some of those roles to the surface, to help people think about those kind of those less obvious roles, I guess. So yeah, thank you for that. So Lindsay, I'm going to come to you now. Could you tell us a little bit about what a typical day looks like for you?
It can be very varied. No day's ever the same, so it's really difficult to say what a typical day would be like. As a radiographer, it's obviously, treating patients, patient care. It can be suddenly that you've got an unwell patient that you need to escalate things for and get them additional help. And so then you've got to liaise with other services and things. As a practice educator, I do a lot of teaching sessions as well. And so I do spend a lot of my time teaching. A lot of my time is spent on Teams meetings as well. So it's a very varied role, and the day can go in a number of directions. It's very difficult to say what a typical day would be like.
Okay, thank you. Jasdeep, what's the favourite part of your role?
I would say it's seeing patients, and actually seeing that improvement in patients gradually. So obviously we come across patients that are really, really unwell, and they need that inpatient admission, whether they're feeling really down because they've got depression, or they're experiencing things like hallucinations because they have got chronic schizophrenia. But then to be able to see that kind of improvement, and our contribution towards that. We have patients who come in completely unwell, and then they leave, absolutely brilliant, ready to go and resume life. So that is my favorite part of the role, is contributing to that progress and being involved every step of the way, whether it's for counseling them around medication, whether it's giving advice to the doctors around how to manage patients, or whether it's supporting nursing staff with medication advice. I think every aspect that we do helps towards getting our patients well and keeping them well. So that's definitely the favorite part for me.
That must be so rewarding, and I think a lot of people, that is the fundamental reason why people join the health and social care sector, because they want to make an impact. So whether you're working directly or indirectly with patients, the values are all absolutely linked to wanting to improve the lives of our community. So yeah, thanks for sharing that. Eleanor, the favourite part of your role?
Yeah, I think it's a lot of the kind of really small wins or really small interactions with patients that I enjoy the most. So being able to hear a story from a patient that they've not been able to tell somebody for a really long time because they've not had the right strategies to support their communication, to be able to work on the things that are really important to them. So, for example, working with a patient to be able to use Alexa to, just something small like that, and being able to just see the small things that make a big difference. And just get into kind of the variety in it. So I work on what's important for the patients, and I can work on whatever they want to work on, and as long as it's about communication, then we'll do it. So it could be ordering a coffee, it could be discussing their previous career and all the inventions that they've made, just kind of how varied it is and how privileged I feel to be able to kind of share those stories with people. You can tell I love it from the way I'm speaking about it.
That is lovely. That is really lovely. Lindsay, what do you find the most challenging within your role? It's perhaps going to be the amount of different hats that you told us about earlier, but yeah, do tell us.
I think the most challenging of my role is, as a radiographer, is that you can't help everybody as much as you want to be able to. There are unfortunately some of our patients that we know we aren't going to be able to help. We can try and make their lives a little bit easier and help to extend their life, by a little bit longer, but there are some patients ultimately that we're not going to be able to save, or unfortunately they are palliative, and that's probably the most challenging part, I would say. It can be quite difficult to deal with those emotions sometimes, but the other challenging part as well, I would say, is when machinery breaks down and things like that, and you've got to tell a patient that you can't treat them that day because the equipment's not working, and it's just getting around those things. So they, I would say, are the most challenging parts of the job, really.
Really, really difficult. That's really interesting to hear. Thank you for sharing that. Abby, gonna come to you next. What skills do you need to have within your role?
So I think organizational skills are really key. So in a job like mine that is a lot of kind of project management, project support, being able to manage your own workload, work to tight deadlines, prioritize your work, often working independently as well, it's quite important. I'd also say communication skills as well. So as I said before, I am asked to write a lot of reports on how various improvement programs are progressing, and they go to a lot of senior colleagues. So being able to pull a really professional, kind of concise, accurate report together when you don't always know a lot about the specifics of the things actually happening is really important. And also being able to kind of provide verbal updates as well on those kind of things. But I think really important is actually being able to manage relationships. I work with so many different colleagues from, in different roles, different organisations, different kind of levels of seniority. And I think just being able to build rapport with people is really, really important. And I think that really means just being friendly and being supportive and reliable is just important. And I think that's probably the case for, most roles. That's a really kind of vital skill to have in health and social care.
Yeah, thank you. I mentioned on one of my first slides about we pride ourselves on career development and progressional opportunities within our sector, and we're fortunate because we are so large that we do have many opportunities for individuals to develop and progress. I was just interested to find out from the panel as to how your roles might have changed since are you still in the same role that when you first joined, or have any of you developed and progressed into a different role? Anybody want to tell us about that?
You want me to go first?
Go on, Abby.
I'll start. So as I kind of alluded to earlier, I started very much not in this role. When I did my degree, I did business management because I didn't know what I wanted to do at school and in A levels. So I thought I'd keep things, very broad. And again, once I finished uni, didn't know what I wanted to do again. So just started in that admin role with Derbyshire County Council just to kind of get some experience. And then from there, kind of, that was my first step into health and social care, I suppose, from that entry level admin role. And then from there, kind of stepping into different roles. So worked in your team, Susan, back in the day, spent a few years with you, just gathering lots of experience and kind of, enjoying the roles that I did. And then if another opportunity became available that kind of piqued my interest or sounded like a good opportunity to learn and develop, then kind of embracing that. So I think I didn't kind of start in this role, and I don't think this might not be my kind of forever role. I think whilst I'm really happy where I am at the moment, I think if something else comes available in a few years, great, then I'll give that a go. I think that's just going to be the nature of my kind of career, and that's quite exciting that in 5 years I don't know what I'll be doing, and I like the variety of that. But yeah, very much kind of from coming out of school like 12 years ago, not knowing what I wanted to do, and starting in in an admin role and being where I am now, I think it's quite a kind of development kind of journey, I think, from my perspective.
That's a really good example. Thanks for sharing that with us, Lindsay.
Yeah, I was just going to say, because I never came through the traditional school to university route. I was 37 when I went back to university as a mature student. So just for those, if there's anybody on there that is thinking of being a mature student, it is doable. So I went and did an access to HE diploma at college, and then applied for a degree at course at Birmingham City University. And then that's how I got into therapeutic radiography. Realised it was the job I absolutely love. It's so rewarding, and I've progressed so much in such a short space of time. Really, there's a lot of scope for progression in these kind of roles, and you can move from like a junior band 5 treatment radiographer quite quickly to a senior radiographer, and then you can then make your choices of where you want to go to. So there's a lot of I've gone from being a treatment radiographer into practice education, and that's the route I've chosen. And that's, as I've become more senior, I gained all those kind of skills and qualities that you needed for that role. So yeah, it is. I just wanted to let, if there's anybody who is mature thinking on here, that there is, there is scope and it is doable.
Thank you. And two very different journeys there that you've both taken. So that's really useful, and hopefully people that are listening to this will be inspired by both of those messages. Thank you very much. So I'd like to ask you all now, what advice would you give to someone who wants to pursue a role in the sector? So Eleanor, we'll come to you for that question. What advice would you give somebody?
I think for me, before I did speech therapy, I didn't really know anything about it, and that never stopped me. I think having an understanding that communication is in everything that we do is sort of the main thing that you need to be a speech therapist. And it's not specifically about a certain kind of work experience. You don't have to go and shadow a speech therapist. Just kind of being aware that the way that we communicate can differ. The way that everybody communicates is different. The kinds of things that we might, I guess, want to get out of a conversation. So I wouldn't say that you need specifically lots and lots of knowledge about how to be a speech therapist, because that's the kind of thing that they teach you when you're training. But I guess that awareness that being a good listener is a really good thing to be, and that actually you come across people who communicate differently from you in any situation. So any experience that you have where you're speaking to other people is good experience to become a speech therapist, and being able to adapt the way that you communicate based on who you're speaking to is sort of the main skill, I would say.
I'm on mute. Jasdeep, same question to you. What advice would you give, please?
Yeah, so similar to Eleanor, really, a lot of the soft skills. So in order to be a pharmacist, you do have to do the degree. But there's loads of pharmacy roles, and there's so many opportunities out there which contribute towards putting you on that path to becoming a pharmacist. And once you've undertaken a degree, so even at like a school level, you can volunteer, you can shadow, you can do placements. There's jobs out there that support apprenticeships in community pharmacies like Boots and Lloyd's, and you can work on the counter and start developing those skills about seeing patients and assessing patients. And you don't need a degree to become a pharmacy technician either. So there's a lot out there just to kind of dip your toes into it if you're not really sure that that's the route you want to undertake. And we do have plenty of pharmacists who used to do those roles, myself included. Whilst I was at school, I used to work on the counter at a pharmacy, and it just kind of helps give a bit of insight into what the roles actually mean, because they're very different from what people think is a standard chemist and that's all you do. You stood there just packing up medication. There's just so many roles to be explored. So it's good to just start to get a bit of insight into what those actually are.
Thank you. That's really helpful. Lindsay, the same question to you, please.
Yeah, so I would say to gain an understanding of what radiotherapy is. It's a very different to the other type of radiography that there is diagnostic. So when you say you're a radiographer, most people do think of x-rays and MRI and things like that. And it's a very different type of radiographer, because we are a lot more, we see our patients a lot more. So you need to have those communication skills. You need to be able to have that empathy. So those kind of skills are really, really important in this profession. The other advice I would say is to go and visit a department. A lot of them do open days or evenings and things like that. We do an open day once a year here, and go and get a feel for what actually the profession is. And I would advise that for any healthcare profession, really. If you can do an insight day, go and do it, because they're often quite different to what you think they're going to be, and you can gain a real understanding of what the profession is going to be just from spending some time with them.
That's a really good suggestion. Abby, over to you.
I think my advice would just to be really open-minded and just embrace any kind of opportunities that are kind of sent your way. I think health and social care is such a good place to work. There's loads of really great initiatives in place to support staff. So whether that's with kind of development and training, with apprenticeships, those kind of things, or even just the more boring stuff when you work for a health and social care employer, like sick leave and good annual leave and that kind of stuff. There's really, really good initiatives when you work for a health and social care employer. So I think just make the most of those things, embrace those kind of opportunities, and really kind of make the most of it.
Thank you everybody for providing such interesting and informative responses to the questions. We're probably coming up to about the close of the session. I just wanted to say a final few words. If participants have got any questions that they do want to put to the panel members, please do use the chat facility to do that in the last few minutes. What I wanted to say from this point onwards is that each registered participant will now be sent further information with the joining instructions for the rest of the virtual work experience programme. That will allow you to complete each of the modules in turn at your own pace and at your own leisure. On completion of each of those modules, you will receive a Joined Up Care Derbyshire certificate, which is then going to be added to your portfolio. You'll be able to use that as evidence to demonstrate that you have undertaken the virtual work experience programme, and count towards your accreditations, and also could be used to support job applications. So I hope that the participants have found that really, really useful. I've certainly learned a few things, and I've been working within the sector a long time. So I want to say a huge thank you to our panel members. We know that you recognise that you're working in very busy, important roles. So the fact that you've taken the time out of your busy schedule to come and talk to our future workforce about your roles and what it's like to work in the sector is very much appreciated. So again, final thanks from me to you, and that is the end of the session. Thank you very much, everybody.
Thank you. Bye.
Thank you.
Thank you.
Thank you.